Hello, my name is Aurora and I am a cancer survivor. And this channel is all about sharing ways to help cancer patients and survivors and loved ones heal from cancer with a little more ease and comfort. And today I'm going to share some tips on helping kids cope when you have cancer. And this is one of the hardest things. I had two adult children and I have two adult children, and they were, of course, concerned when they found out that I was ill. And the more facts and information I gave them, the more secure they felt. But I have two younger kids. They were 7 and 10 when I had my first surgery. And for my first two surgeries, we didn't really know the full situation, and we thought that it would just be a tough few months. And at the time, we simply told them that I had some toxic things in me that needed to be taken out, and that it would be tough but okay. Then a year and a half later, things took a turn, and I got a different, more serious diagnosis, and we knew we were in for a much longer, tougher experience. So first I'll explain how we decided to tell them. I was diagnosed with the big bomb was dropped a week before Christmas. And we knew right away we didn't want to ruin Christmas for them. We aren't religious, but we do celebrate a lot of the traditions associated with Christmas and the Yule season in the US. And this is a really special time for our family. And we knew that the upcoming years would be challenging, and we wanted to give them some happy memories to have and to hold on to before we broke the tough news to them. So some considerations for if you are choosing to wait to tell your children that you have cancer, or your grandchildren are just littles in the family, if you're not going to tell them right away, kids are smart. They will hear things, and you have to be very careful which adults that you choose to share the news with prior to telling your kids. You want to be able to control the narrative around the experience for the kids so that you can help meet them where they're at in terms of their fear and anxiety. And in our case, we decided to tell only two people who are like sisters to me and who are on my living will as people to help my husband make medical decisions if I'm incapacitated. So we did not tell any other family members except them until after we told our children. So we waited until we felt comfortable, and we waited not just until after we told them, but until we felt the kids understood. And then we told our employers much later. In fact, telling employers in the United States can be really complicated, and I'll have a whole other video on tips for how to navigate time off and to know your rights to paid time off and family leave, and how they change when you have cancer, and even further if you have breast cancer. So there's a couple of federal laws that make it easier for you to take time off and make it easier for you to navigate your employer, and it's important to know your rights, but that's a whole video by itself. So first, we just told only the people that we really needed to know, and that we felt safe knowing that they would not spill the beans. There are a ton of good books out there to help explain things to kids of all ages. So we found it useful to have those books on hand when we told them. We decided that if they seemed too overwhelmed, we'd hold back on the books, but if they wanted more information, then we'd have them ready. So I've linked the two books that we use below. One is for more of a middle school, high school age, and then the other is for a younger child, elementary age child. So be prepared when you tell kids that they may react with anger, not with fear or sadness, but I mean, they are afraid, but the anger is masking the fear. But sometimes they will react with anger and sadness simultaneously. My daughter was exclusively sad, my younger daughter. My younger son, he was angry with some sadness. But they were both scared. And often with young kids, we try to encourage them or direct them to express their anger in productive ways and to just not to have a tantrum, because having tantrums past a certain age is not socially acceptable. But in times like these, when a parent is possibly going to be taken from them and their entire world is turned upside down, we held back on the, express your anger appropriately speech, and we just let them do what they needed to do. And once they had a day or so to absorb, we revisited the topic and worried about, let's express this appropriately. So how to actually say it. We found a time that was not rushed, and we were going to be home for the whole day. And we didn't schedule anything for the day, and we let them know that we had to have a family meeting and that it was something very important. And I took some time to write down what I wanted to say and then read it to myself several times over a couple of days to prepare. And I told them that I went to the doctor a few weeks ago, and when I went, they found that there was something wrong in my chest. So I've been going back for tests over the past few weeks to try and figure out what it was. And I know now that I have cancer. And I know it's a scary word, but there are lots of different kinds of cancer, and some are not as dangerous or deadly as others. And sometimes with cancer, if you catch it early, there's a lot you can do to get rid of it and heal yourself. And there's lots of things I can do and that we'll do together to make me better. And it'll be really tough with lots of surgeries and lots of appointments. But we're a team and we do everything together. And we'll do this together too. And no matter what happens, I love you more than anything. And that's it. I told them I have it. It's scary, but it can be cured, or it can be gotten rid of. I can go into remission, and we'll do it together, and we'll be together, and it'll be okay. Even if it's sad, it'll be okay. And then I asked them if they had any questions. I answered every question very scientifically, so I tried to make sure that I understood everything that the doctors were telling me and all the information to be able to pass that on to them in a way that they would understand. But I didn't use any euphemisms or try to make things sound pretty or better. I just gave clear facts. And this works very well for my kids. They don't want to be treated like babies. They want to have a say in things, and they want people to treat them as if they really do understand what's happening. My son was especially angry, and I could tell that he needed something to wrap his mind around things and have a sense of control. And so I made him a decision tree that mapped out the choices we would have in each scenario. And it looks kind of like this. Each time we had a surgery or made a decision, he got to mark off what was happening. So you can see that just any old pencil would not do. He had to aggressively scrub out each surgery with a Sharpie. And this chart was really important to him. And after the final surgery, he took the chart, and I asked him if he wanted to burn it, because sometimes we do that. If they have a worry or a concern, they'll write it down and we'll burn it in the fireplace. And to my surprise, he said no. He wanted to keep it. He filed it away in a special folder, and I think for him, it gives him a sense of victory over the situation. So if you have a child that is very analytical, this decision tree option might be a good tool to use, because it lets them know what things could happen. I also gave him his cancer book right away, and he still has it. I gave my daughter the book after a few days, and it was a bit of a distraction for her, but she did not engage with it in the way that my son did. She didn't seem to connect with it. So sometimes they'll surprise you with what helps them through, but that's how I physically told them. I think timing is important, environment is important, giving yourself space and giving them space to have a really big reaction, or to have no reaction where they're just kind of like, oh, and they kind of withdraw, and give them time to process it and come out. But that time is very important. I also wanted to give him a sense of agency, like, because it really helped my son, as I said, to have that decision tree, and then he could see where things would go and mark off options. Um, so we included the kids in the knowledge of the daily schedule of the doctor's appointments and the surgeries and everything. So they knew when I had a doctor's appointment, and since my daughter was old enough to have a phone in school, I'd text her that things were okay. We would tell my son as soon as we picked him up what happened. And we didn't make the news dramatic. We kept it pretty mundane. So I'd say things like, today I met with my surgeon and found out what kind of bandages I will have. We're going to have to do a lot of laundry. Or today I found out that I have to sleep propped up for 6 weeks. I hope it doesn't make me snore. Stuff like that. So when I got my pre-surgical gear, which I have another video that shares a bunch of things that I found over time really help you the first couple of weeks after a major surgery, and they're inexpensive, easy to find, and great products for just helping you settle in and be more comfortable during the first few weeks post surgery. So the kids helped me unbox everything, and I let them play around with the foam wedges and test out the breast cancer pillows and the cold cap and all of that. And we talked about the surgical dreams that I would have and how gross it would be. And this was really good actually for a 4th grade boy to talk about gross stuff. He loved it. We talked about all the hair that I was losing. I lost a lot of hair. And whether I should cut my hair or tough it out. And with my son, I watched some interesting videos of similar surgeries on YouTube so that they knew what was happening. And, he thought the bone saw was really cool. My daughter did not have the disposition for this, and knowing exactly what was happening to me, like seeing the surgeries, she didn't like that. That was scary for her. So we did not watch anything together. She didn't want to see the videos, and I didn't push it. That was just something I shared with my son. So it'll be different for each kid. It'll be important to adapt to what they need and not stay with what you think they should have, because those aren't always the same thing. So in addition to telling them, timing, giving them a sense of agency, we also made sure we celebrated successes. So we would pour Martinelli's, which is just a sparkling cider that's non-alcoholic, or we'd mix like apple juice and seltzer water into champagne flutes, and the kids could have those, and then we would toast a successful surgery with them. And as soon as I was ready, they would climb into bed, and I would read mysteries to them, and we would just hang out because I was stuck in bed. So they would get their books and things, and sometimes I would read to them, and sometimes we would just all hang out and read together, and they could be physically with me. And my husband would bring dinner into our room because I had to eat in bed. I couldn't get out and walk around, and the kids would have a carpet picnic. So they would eat with me, and they would sit on a blanket on the floor, and I would eat at my bed desk. And doing all of these things together and including them, instead of trying to force them to have a normal life while I was sequestered, recovering for a couple weeks before I could really go up and down the stairs all the time for dinner, having them be with me and just saying, you know what, life's not normal right now, so we're just going to do it differently, and keeping us all together, that helped. That actually made it seem more normal than if I had just been away and they were eating at a table. The next tip that I have for helping kids cope is to know when to get support. Because while all of the things I've said so far are great, in our case, and probably in many others, kids will need professional support. If you are being treated in a cancer center that has a supplemental support program, they may have a free counseling program for kids. The hospital I was at did have a support program, but there was nothing for kids at the time. Luckily, I had really good health insurance at the time and was able to get the kids a counselor. And if you live in an area where the waiting lists for kids therapists are extreme, like in a major city, I lived in Chicago at the time, you can get a special referral from their pediatrician or a recommendation from your oncologist to bump them to the front of the wait list because you are a cancer patient. So sometimes when I was trying to get them appointments, because we didn't have a regular therapist or anything that they saw, this was just, new, obviously, as a reaction to the cancer. I was being told, oh, we have openings in a year. We have openings in 8 months. I'm like, well, my surgery's in 6 weeks, so that does not help them. And so if you are in that same situation where you're being told there's these extreme waiting lists, ask your pediatrician, ask your oncologist, your cancer doctor, if they can give a special referral and you can get the kids bumped to the front of the waiting list. So ask your care team also, if you are whatever cancer center that you're at, you should have a care team, and they will be able to help you navigate what options are available to you for your kids. And we just did weekly Zoom sessions with a counselor for each of them, and that helps them to process their fears and their feelings around what was happening. And that was a great additional tool. But even in that case, sometimes they'll need more, like a lot more. My son needed a lot more. He was my youngest and is by far the most thoughtful child that I know. He will get himself wound up worrying about things. And you might be surprised that you may have a kid that's very quiet, very calm, and then suddenly they start acting out in school. They start snapping at teachers that they love, making rude comments, isolating themselves, having trouble with social interactions. All of that is totally normal when a kid is grieving. And when a kid finds out their parent has cancer, they may go through the grieving process. They're scared. And that kind of behavior is normal. But you do need to communicate with the school. It's very important. We told our kids, counselors, teachers, social workers, principals, everybody at school before we even told our employers, because we wanted to be sure that any misbehavior that might come out of their grief and their fear was viewed in context, and that they both had a support system at school to help them behave and keep their learning strong, because life isn't going to stop just because somebody's sick. We were lucky. We had a really good team at our schools. We were in public schools at the time, but we had some of the best schools in the city. And I will always appreciate my son's 4th grade teacher for her fantastic assistance. She was just phenomenal. So in addition to the way that you tell them your timing, books, resources, counselors, it is important to communicate with their school as well. And all of those things will help build a support network around the kids to help them when they have a moment where they're stressed and they overreact, or where they're frightened, that there will be people around them that know the situation. Having their friends' parents know and say, hey, yeah, my son's coming over to play, but just so that here's what our family's going through right now. I don't know how he's going to be, or I don't know how my daughter's going to be. She might start crying. Here's what's going on. Just sharing that. You don't have to give all the details, but sharing that with the people, the adults that are around them, will help those adults assist your child in navigating social situations. That's really important. Things that I would not do again. So there were a few things that did not go well when it came to our kids, and most of that had to do with the kids seeing me too soon after surgery. So when someone gets out of surgery and first comes home, they may have on compression garments. They'll need to figure out how to go to the bathroom with the compression garments on, and with surgical drains and all kinds of wraps. They will be in pain, and they might be in extreme pain depending on when their last painkiller dose was before they left the hospital. And there may be a stretch there when they very first get home and are getting settled, where they're in extreme pain because the doses were too far apart and they need to get themselves on a good schedule. that is not the time to bring kids in to see them. It is upsetting to the kids and it is upsetting to the patient. People thought that it would cheer me up to see my kids, but it did not. I was not ready to see them. I needed to settle into my pain med schedule. I needed to figure out how to protect my modesty while dealing with miles of bandages that did not fit inside my pajamas, and how to manage my drains. It is usually best to wait until the patient says they are comfortable seeing their kids. Phone calls and texts can cheer the kids up until the patient is settled into their own bed and in a comfortable routine. This might take 24 to 48 hours. So I recommend not just bringing kids in to see someone. It might be embarrassing or stressful for both the patient and the child. Wait until the patient is settled, double check with them and so that they're comfortable and know when is it a good time to see the kids. There was also a time during my cancer experience when I was in ICU in critical condition for quite some time. And the doctors and nurses decided that it would be wise to let my kids come and see me and make an exception to them coming into ICU, even though one of them was too young. So for some of you, that might sound like, oh, well, so they called in your family? And yeah, they essentially, yes. So I was not in good shape. And they were like, yeah, this would be the time to see the kids. So in theory, this could have been a beautiful moment to possibly say goodbye or just to tell them that I love them or whatever. But in reality, it was horrible. My son was terrified and angry and started silently kind of punching at the couch. My daughter wouldn't look at me and she just sat on the couch sobbing. I had a nasogastric tube, so I could not drink. So I was super thirsty and I couldn't talk very well because I was thirsty and had tubes coming out of everywhere. And so I tried to tell them that they needed to calm down. Our social worker was going to come and take them in the hall, and she was going to calm them down. So they needed to calm down if they wanted to stay. But because I couldn't talk well, they thought I was telling them that the social worker was going to take them away from me. They were going to go take away and live someplace else. So then that really got them sobbing. And they were totally unprepared to see me looking like that. And they were so stressed out and so upset. And my husband felt awful about it. And he's trying to calm them both down. And it was just a mess. And luckily, a fantastic social worker did come. And she did take them into the hall and calm them down and talk to them and gave them a game to play. And eventually they were able to come back and to hold my hands for a few minutes. But overall, it was really terrible. If you find yourself in the unfortunate position of kids needing to see a parent or a grandparent or another loved one in ICU or in a medically delicate state, mental preparation is key. So my husband's family did not elect to come and help him during the month that I was hospitalized, and so he managed much of the time on his own, balancing his work, 2 kids, dealing with the house, helping out with my students because we both worked for a university at the time, and also coming to the hospital to spend time with me every day. So we were blessed with a fantastically supportive community and neighbors that allowed him to spend hours every day with me at the hospital and sometimes stay the night by my bedside. But still, all of this meant that he was completely exhausted, mentally, physically, emotionally exhausted. He was not in a place to consider things like, gee, perhaps I should mentally prepare my kids for what I've had a front row seat for 3 weeks. Like, he just wasn't, he was tired. And it didn't occur to either of us until it was in the moment happening. And we were like, oh my gosh, we should have done this differently. So hopefully our unpleasant experience can help other people out there to know that it is really important to let kids know when they're coming to see someone in a medically delicate state that the person that they love is still there under all the machines and is still excited to see them, but that they need to understand the person will look different. They might have parts of their head or body shaved. They'll have a lot of beeps and bleeps and machines going on, and they may not be able to talk or eat a lot, but it doesn't mean they can't interact. And so things might look scary, but that there are a lot of medical staff there to help their loved one, and it will be okay to ask the doctors and nurses questions when they come in, and you can find out lots of really interesting information. And just to prepare them, this won't be a cure-all for their upset, but I believe that had we known how to just give a little bit of mental preparation to the kids, it would have been extremely helpful to them so that they could digest the scene in front of them. So please consider that the kids will need, they'll need something, they'll need to be prepared, they'll need something more. Cancer is tough on the whole family unit, and letting the kids know that they're supported and that it's okay to be scared is really important, because being brave is about doing things when you are scared and doing them anyway. So hopefully this helped those of you with littles in your life have some way to think about some ways to support them and work through the experience of cancer as a team. And I hope to talk a little bit more about things like advocating for yourself with your employer, with medical staff, with billing, and some other challenges that might come up when you have a diagnosis of cancer or a major illness. So I will see you in my next video. Until then, stay hopeful and take care.